And thank you. And Christine, you got sore? Got sore? Were sore?
No, I felt great after all the ATMs, and then on Saturday, I mean, this often happens to me, but I was just doing something seemingly innocent. Like I think I was just lying on the ground actually, and my dog came up to me and put her big nose in my face, and I just went like that, and there went the neck. So then, you know, stiff neck, frozen neck, whatever the term, technical term is for it. So that's.
And you still feel? Are you still in that space?
I've still got limited movement. Yeah.
Did you notice anything or reflect on how you moved when the dog came up?
Well, I guess it was just a sharp, quick movement. It's one of those things. I mean, I didn't think. I just, you know, I wasn't doing anything crazy.
Yeah, and sometimes that happens. Circumstances are such that we move quickly to avoid something, or as in your case, you know, your dog's nose. And then depending on our organisation and our habits, that may be organised in a way that doesn't create strain, or it can create strain on the system. And if you have a predisposition in that direction, then what our nervous system engages is, when we want to move quickly, is what we know how to do well, usually, you know. So those opportunities, although we don't like them, they are opportunities to observe what we did and how we did it, and to try and learn from that situation. Thank you.
Sorry, but you don't think that, that maybe I had overdone it in the ATMs a little bit? I know I'm inclined to do that, according to the other Feldenkrais practitioners have told me that I tend to move a bit quickly in the ATMs and often move into the movement a bit too, like I don't take it slowly enough and things like that. I'm just wondering if...
Do you know that about yourself?
I kind of think that's just my nervous system's speed. Like at the moment, like that's... At
the moment, did you say?
Yeah, it may slow down, but that's where I feel comfortable with it, and almost sometimes to slow it down even more is, I don't know, sometimes doesn't... That's just the speed I go into, and it's only when I look around at the speed other people are doing that I'm like, oh, hello, I'm going really fast. But I wondered if, you know, that many ATMs for me in a week is a lot, being a newbie, so I just wondered if maybe that had predisposed me to being some different things going on in my body, just made me a bit more vulnerable to a twitch and from a... So
it's great, you did reflect on it even more. Yeah. So one of the things that we're doing in here is exploring choices and discovering what choices we have, how can we notice our tendencies and our habits of moving, and whether we can develop other choices. Some people do move faster than others. Some people move slower than others. I'm probably on the slower end of the spectrum. I like to go slow. Some people like to go fast. Then it's, can you try out something else and notice if it makes a difference? It is also true that when you are doing a lot of ATMs in an intensive period of time, there is a reorganisation going on that may not have quite integrated into your neural pathways in a way that it can be called upon easily. So we can be a little more risk of hurting ourselves, especially if we're doing familiar activities that involve, you know, like a sport. So when I've given lessons to clients in my practice, I usually advise them not to engage in that for 24 hours or so, or if they can, to do less or slow down, so that they have more opportunity to keep sensing themselves and integrating the connections and the coordinations of the different parts of themselves.
Is it normal that you dream a lot about Feldenkrais during the night?
Anyone else find they're dreaming more or dreaming differently? Yeah.
Especially about movement.
Mm-hmm.
Okay.
Because you are interesting your nervous system in how you are moving. So there is a huge proportion of time and activity that you're directing in that way. And so our nervous system is pruning, evaluating, disrupting synapses that, didn't like or didn't use, and integrating others. And we do that as we sleep, and often comes forward in the dreams. Mm. For some, it can be movement. For some, it can be just more vivid dreaming. For some, it's no dreaming. Many possibilities.
Funny listening.
Are you enjoying those dreams, Karen?
Yes, I think so, yeah.
It's funny just listening to Christine and now to Karen. Suddenly things come back.
Yeah.
Just realised that I was quite sore in my hips, but I didn't think of it when you first asked the question. Yeah. And just now, Karen talking about dreaming, I realised last night I was dreaming about slipping and sliding through sand, and it was real good fun.
Mm. Thank you. Anyone else?
Tried out something I haven't done for a while and sat on the floor. Had a different approach to it. Slightly different approach, and although I was stiff, I wasn't actually in pain, and the recovery from being in that position was faster. And I liked that, and I can relate to what Christine said about, I'm not learning now, so I can feel the habitual places that I would lie or stand, and I only have little bits of opportunity there to just change the breathing or do something with my neck, or my eyes are good to shift that. So the habits are still there. Mm-hmm. But there's more options, and there's more flex, and there's more, we're smarter than this. We don't actually stay in pain for 24 hours anymore. Mm-hmm. We recover faster. And I thought that was really exciting.
Great, thank you.
I know the first night of the weekend, it was like hurdy-gurdy, kind of woke up, I was like, I felt a bit hurdy-gurdy, like everything was trying to synthesise.
Uh-huh.
Yeah, and then slept like a baby the next night. It's like it had sort of sorted itself out a bit. Yeah.
I think some other people were noticing that they were having difficulty sleeping because of the stimulation and everything that was going on. Okay, well, thank you. So, can you read this writing here from where you are? Oh. So, well, then it'll be difficult to write on because it's going to cover the other things. So I was trying to. So last week, on one of the days, we were looking at what we can see in movement. And you were in groups and noticing the different aspects of movement that you could observe. So we're going to start to distill it a little bit and develop a language that can be very useful when you're communicating with one another, because it's sharper, more direct. And often in our lives we're used to describing things as very mobile or stiff or loose or these sorts of words, which often have some judgment or bias and can be perceived in a critical kind of way. So we were thinking about timing, orientation and manipulation. Tom's the sort of AKA that we tend to use. And last week we had up there, we divided it into the categories. We didn't quite get to listing what you'd seen and trying to see which component they fitted into. There will be differences of opinions. Okay, it depends on your understanding of the words, your experience with the words. But this, I put on here because there was another list. So I've started to put in here what I could sort from your lists of descriptors or, your little, the way you described it. Okay? So we were doing the movement of tilting the legs, crossing one leg over, tilting the legs, and tilting the triangle of the arms. You remember? Okay. So some of you noticed the speed of the movement. So what can we notice about speed? Is there only one speed? No. Speeds. So faster or slower? Yeah. So speed we can have faster, slower. You also begin to notice, and that's a timing factor, yeah, as relationship with time. Initiation, where the movement started and what moved first.
Is this about sequence?
That was about initiation. The sequence is the next one. We've got sequence. We're looking at the aspects of movement that kind of fit, or could be seen to fit in this way. And later in the week we'll do more, where you're going to discuss it and try and describe it for yourself a little more clearly. But initiation was what starts the movement. So someone said the movement started in the knee. So that was what moved first, and also what moves the knee. Because the knee's moving in space. But it's not necessarily, it's got muscles that move the bones. So how we could look at how the knee was being moved. What was moving the knee that was initiating the movement. So there's the where and the what. You can think of initiation as having a where and a what. And you could think of those being the same. They may be the same. Then you talked about the sequence of parts, the sequence of involvement. Some moved the head first, some moved the arms first. Yeah? You have a sense that has a component of time in it. One moves, then another moves. Then you noticed something about the flow of the movement. And these, we're separating them out. But in the present moment when you're moving, they're happening together. And some of you are more likely to observe some aspects, and others are more likely to quickly pick up on others. But by expanding the possibilities, it gives you more tools to observe yourself and more tools that might be useful in observing others. So in the flow of the movement, which is connected to the speed, you noticed hesitation. Do you remember that? Someone noticed hesitancy? And that can have a sort of an interrupted quality. So movement, the flow of movement can be interrupted or hesitant. And it can be smooth. I'm sorry, I don't know your name. Barbara, thank you. Hold on 1 second, I'll get the microphone. Do others know you too?
Yes.
Yeah, okay.
I think most people do.
Okay.
I'm a weekly. Yeah, so I was just thinking about flow and how it can be interrupted, which sounds like kind of a jerky movement.
Mm-hmm.
And then I thought it could also be paused,
Mm-hmm.
which can be part of the flow.
Mm-hmm. Yes, Martine?
When you look up the definition of flow, flow is really doing something with losing a sense of time, being totally absorbed. There's some very good explanations which I just can't recall, but generally the gist of it, losing yourself in whatever you're doing, the sense in the quality of whatever you're doing, and lose the time.
Mm-hmm. Used in different contexts, I think. There's quite a bit written about flow, being in the zone, in terms of the way we can create and be present to a moment. And this, we're talking about it, like water flows down a hose. Something, maybe that image.
Physical flow than psychological flow.
Yes. Because we're relating it to ourselves in action. But it could be applied that way also. Right. Mm-hmm. Mm-hmm.
Can we just give you the mic?
Yeah, I think it comes both times, the physical and emotional together, whether it's a good feeling or a negative feeling. It disrupts or enhances or does something with the flow.
Mm-hmm.
I learned the distinction between these ideas or these words by doing an ATM and people watching me move and going, it's really, you move, you pause, you move, you pause, you move, you pause. So that my movement within the flow had a different quality. So it didn't mean that there wasn't a flow, it just meant that it was a particular quality to it. So in the flow is an awareness thing. In my experience, I'm very big and I'm expanded. I'm in the flow. But that doesn't mean that my movement is necessarily going to be smooth.
I think you also bring up something, Margaret, and that's about rhythm.
Yes.
Or tempo. So I'll leave it as, I've got the pause in there. Mm-hmm.
When you mentioned water flowing down a hose, you have to have an inflow and an outflow.
Mm-hmm.
So some movements flow in and some movements flow out.
Could you do a movement that flowed in and a movement flowed out for me? Yeah? Okay. So what are we, just think, what are you observing there? Opening and a closing. Direction. So you had found, some of you had observed direction in a movement. And the opening and closing. Opening, if we think of a pattern of movement, an organisation of the skeleton, there's a certain pattern because of our structure that is enabled. And we call...
There's still the breath that's
extension.
In and flowing out.
Yes. Opening, extension. Folding, flexion. Pen's getting less marked.
They're just
So
also interlinked.
They are also. That's great. That's
You've got
really
indirect flow and direct flow, and
yeah.
which is linked to
And
direction
you can spotlight in on, say, breathing, and look at the flow of how someone breathes, and then perhaps take these lenses to see what distinctions you can make.
and the flow of the direction, and
Yes. Yep. So if we go, so we've got direction. What directions do we have?
So that.
You going to say something, Yana?
So these two ideas together remind me of in the last ATM last week, how I got a sense of the two sides of my body. Sort of, there was the midline and the muscles going one way and the other, and I could kind of feel that movement at the same. I can't hold it and do it, but I could feel those muscles go down while these ones came up, and vice versa, and feel that line through it. So that direction and flow at the same time, up and down. And then at the last one of the last segment, I could feel it the opposite, like the sideways way. Like I could almost feel like where the muscles join together, those ones going up, these ones coming down, and vice versa.
So there's several ways, if we use this lens, that I could describe what I'm seeing with you. So you were talking about this, okay, which is again a pattern of movement in the skeleton, of side bending. And then when Yonna's talking about closing and opening and the movement of these muscles, she's also beginning that action of extension and flexion. We don't need to see the whole full extent of extension to perhaps see a hint or a shadow of that particular pattern. So if I'm sitting here and I do this, you see that I have certain parts of me have a direction, but there's a whole pattern that is possible. May not be completing it, but of side bending. Does that make sense to you? And in these patterns, you make shapes. And in a shape, you may feel it has symmetricality, is that a word? Yes. Or not? Thank you. What's that? Okay.
In the language of flexion and extension.
Yep.
Does side bending, is that like lateral flexion?
Lateral flexion. Thank you. Side bending.
Sorry, DVD people.
Okay. So you were looking at the pathway through space, both of the arms and of the knees. And the pathway had a certain shape. And because of the structure of us, often we move in arcs, because no joint is flat. They're all curved. So that's conducive to these movements in space, which are more spirally or arcing. We can organise ourselves to make straight lines, but most natural movement isn't in one plane, in one direction, although we can organise ourselves to do it. But having some understanding of what the patterns are can help you sort for what you're doing, whether you're doing a combination, and often we do combinations of these movements. So in the tilting the knees, there's a combination of turning, rotating around the central axis, of extending and folding at different timings or different parts of the movement. Okay, so then a lot of people noticed the foot on the where the foot was placed made a difference to the movement. So location, and the location can stay the same or it can move around, like you were trying different places with the foot. Directions. I'm moving to the right. I'm moving to the left. Forwards, relative to myself. Backwards. Where am I going now? Down. Okay, so directions. And then this space that we're in, we can orient in space. So this relationship can be to ourself, to the ground, to the room, to gravity. And when you're given a direction in an ATM, often at first, it might not be clear until you're given more information that's contextualized. Whether you're moving your hands towards the floor, whether you're moving your hands upwards and backwards a little bit as you move, so that the relationship in space can change. Who was it, Danielle? Is she here? She noticed, not yet. She noticed in Simon's movement that she could see the trajectory. She could see where he was orienting to, even from the beginning of the movement. Now there were, coming over to the self-organisation, how our nervous system organises the part within our physical frame, or emotional frame, or cognitive, also, all aspects. We noticed qualities of movement. So whether someone was efforting or whether it looked effortless. And there were some other qualities that you noticed that weren't on my list, that were on the other list, not this list.
Do you want to say something about the congruence of the pattern?
Go for it, Jenny.
So sometimes we can see that most of the person is going into side bending, or, as Judy demonstrated, inwards or outwards. But sometimes a part of the person is not joining in, is going either nowhere or in a different direction.
Mm-hmm. And would you put that in congruent, in equality, or would you put it in the pattern?
I think it's more about the pattern, because it's making a different shape, and it's not a it's not a congruent shape. It's got a discontinuity in it somewhere.
Yeah. Does that make sense to you? Okay, I can't put this in. Thank you. What other qualities? Or anything with a relationship to anything here, can you think of?
Do you want one on the list?
Yeah.
Harmonious was one of the qualities
Thank
that
you.
we noted.
We had another word there.
Graceful.
The other list word was coherent, but that also fitted the pattern. I have the baby list. Only those ones. Not the whole list.
Yes? Did you hear that? Could jerky and smooth be considered as a quality as well?
Yes, of course.
We're just trying to make distinctions that may or may not make sense to you. If any two practitioners or any 2 or 3 trainers were in the room, they'd probably have different views on this. The background for this particular frame was developed by the teaching team from this training program.
It's really hard to put them in a category and say they go there definitively because it's the context in which you use them that gives them meaning and articulates what is going on more for you or for your... No, I'm not talking to
Thank you.
you. Have to help me.
So it's the context that gives them meaning, and it is a bit challenging to talk about it in isolation. This because if you've got someone moving right in front of you, you will be able to negotiate the language probably in a way that'll be more. You're each able to associate with what the other's seeing, perhaps or perhaps not.
Perhaps you can put all of flow over into a self-organisation if you wanted to.
No. I wouldn't.
So it's something to think about. You know, it's something to think about. You'll be doing a lot more in relationship to this over the years. And it's part of an action. When we're looking at it, we're looking at when in real time how someone moves. And then beginning to see, does this language fit? Does it give you a clearer understanding of what someone is asking you to observe or what you observe in yourself? There is no definitive definitions. I was talking about it with my husband on the weekend, and we're talking about the difference between sequence, and the other one that you did have was coordination. And you can see there are overlaps. So I looked sequence and coordination up in the dictionary. And the difference was that sequence in the dictionary had the element of the timing of the ordering of the parts, whereas coordination was moving the parts together. Without, but there is a timing, an element of time in there. So you're happy to sit with that for now? Jenny, you got another comment you'd like to? Ruth, any comment you'd like to make?
Well, only that I think what people have said, that sometimes it's difficult to put it into a category that might fit in. Well, I think it's that thing that sometimes
when I was going through the list and trying to put them in categories, they could go into 2 different categories. So as you say, it just depends on your lens.
Mm-hmm. And there's different systems for movement notation, and Zoran, who's taught movement education and will be doing segments with you, has done a lot of work with that, and he and Julie in particular, Jenny, Susan and myself, have had input into trying to create a frame that we most agree with. But it doesn't mean you have to. What's important is to question it and develop your own thinking and understanding around it. But can you imagine getting stuck in an ATM and thinking, what do I do? Perhaps it would be possible for you to think, well, is it something about my timing? Is it something about how I'm moving the parts? Is it something about the plane I'm trying to move in, or the pattern? So that it can be a useful tool for yourself in understanding how you're organising yourself.
Question?
Mm-hmm. Thanks, Ruth.
When you say the teaching team has tried to develop this framework, do you mean the Australian teaching team? And does the
and the trainees of the last training program?
Right. So does the European kind of teaching fraternity have a different view? And did Feldenkrais himself have a framework that he specified?
So I've taught in quite a few training programs around the world. There are a couple of educational directors who use this type of movement analysis, and many don't. And one of the things that has been observed historically in Australia and other countries is that when there isn't a framework or a language that's developed, it's easier to get lost. And I think in the Australian programs, and with a great facilitation from Jenny, there's this desire to improve the standard, the quality of teaching, and the competency of the practitioners that graduate from the programs. Some people, this may get in the way right now. Others of you, it might assist, might be a tool. But you will be introduced to many tools that can serve your learning in a way that is uncommon I think, in the international training environment. As I said, there are a few trainers that pay a lot of attention to it, but they're less common. So most educational directors have a different belief about or use a different style in training programs. Moshe talked about it a lot in Amherst, but he had trouble finding the language. So for me, often when I listen to him now, 20, 30 years later, I can make meaning of what he's saying, I can make sense of it, but it's not necessarily clear and easy to grasp. So there's an endeavour to clarify, and a big difference in different training programs.
When you were just saying now about how to observe your movement and maybe use those guidelines.
Categories or descriptors.
Categories. I was wondering, because that's something I noticed with myself, and I was wondering where it would fall into. I found that my focus plays a big difference in how I can detect things. Focus or or less focus, more focus or less focus. If I focus too much, I get stuck. If I focus in a certain way, I find things often fall into place. But I was just wondering if that...
Great. What are you focusing with?
It's a combination
Mm-hmm.
of
But
everything.
how do I bring this mat into my focus?
I look at it.
Looking at
Feel
it.
it. Feel it.
Feel it. Good. Change my gaze.
Inclusive attention.
Inclusive attention.
Yeah, but that's a vague word.
Pardon?
Inclusive attention is vague for me.
Okay, so I appreciate that. So attention and how we use our attention is very much a part of, and where would you put it? Pardon? Can I draw a circle on the wall? Yeah, okay.
Like, to me, that seems like those things are ways to describe movement so that we don't, as you mentioned before, we don't want to use loaded language.
Mm-hmm.
So these are just ways to describe how somebody's moving. But what you're saying about inclusive attention, that's more how you actually direct the movement within yourself, how you pay attention to it. So it's a slightly different category in a way.
Well, it's like the physical or could be like the physical emotion aspects of flow. They're absolutely intertwined.
They are.
And it is we organise our attention through our physical body, through our capacity. So,
but we can't judge how somebody else is directing their attention, only that person can. So if we look at this as a way of judging other people's movements, but then attention is something that you only yourself know where you're directing it. Someone else can't judge that. They can guess at where you're directing the attention, but they can't tell you for sure, only you know for sure. So to me, these lists are just how another person can judge your movement, but what you're describing is how that person themselves feels the movement.
So this is for both purposes. It's possible to use it for both purposes.
Okay.
So as Jenny said, as Jenny suggested, how about we put attention as it can be a way of looking, we're attending to this now. We're directing our attention to it. Now maybe part of my attention is hearing the jug boiling over there, and part of it's on what the weather's outside, so we can expand our attention and we can shrink. I don't know if you remember from some of the ATMs that you did with Julie and the eyes, that there is a hard and soft focus, there's inclusive and exclusive ways of looking. So
it's almost like probably describing mindfulness. You don't get stuck on one thing. In mindfulness, you notice things, but you don't get stuck on things.
So you're talking about an inclusive attention.
That's
perhaps.
what for me
Yeah.
is inclusive attention is a mindfulness approach. Yeah, soft focus.
In the Laban movement analysis, they talk about space when they talk about indirect space and direct space, and it's got to do with your inner attitude towards space. So if you've got an indirect attitude, you are like this and you're taking everything in. But if you've got a direct attitude towards space, it's singular, and it does come from within, but it also includes outer space. So I don't think you can have that distinction between...
Yeah. So the boundaries blur. So just going on about the space, Judy was talking the other day about the kinesphere, and some people brought up, so it's the volume of space you're using around yourself, just tagging on from where you were, but there's also the volume inside that is created through a certain organisation. So attention, I haven't quite got room to write all the multiple ways that we can move our attention. But attention can have an orientation, can have a timing to it, how long we stay with our attention directed in a particular, to a particular aspect. And it's certainly about self-organisation. If I am in pain, maybe it's going to be difficult for me to have a soft focus or more inclusive attention, because I keep being called to checking out, what's happening. So we'll try and put the other things up on this list later today. Any other comments before we leave it for now? Questions? Thanks, Ruth.
Yeah, I'm just trying to pay attention to that language. And when you say soft focus, what's the how do you term the opposite of soft focus when you're really focusing directly on
hard?
So you would term it that hard focus. Okay, just haven't heard.
Is that Julie's word too? Hard, soft? I think so. Yeah.
Yeah. Okay. Thank you.
Yeah. Okay, let's take a break. And then when we come back, we'll do some ATM. And we're going to return to this later in the week. So for just 15 minutes.